Hi, my name is Andy Allen. I'm a fourth year at Temple, and I'll be going into psychiatry this upcoming year. Um, I, I was asked to talk about how Temple creates such not only great physicians, but also physicians that are humanistic in their approach to caring for patients. And so I just wanted to talk about kind of my own background and how I feel like I'm prepared um, after I leave Temple in the next couple of months to really go out there and use a humanistic approach on the patients that I'll see. Like I said, I'm going into psychiatry, and when I started my third year psychiatry rotation at Temple, I had no expectation that I was going to go into that field. It was just a required thing that I had to do. And I remember one of my earliest patients was this man who was actually the same age that I am. Our birthdays were actually very close to one another. And he was suffering from schizophrenia. And not only was he suffering from schizophrenia, but before his diagnosis and before it really took a hold of his life, he was quite successful. He had a family, a house, children, and after his diagnosis, all of that fell to the wayside. When I met him, not only was he suffering from very severe hallucinations and delusions, but he was living in an abandoned house. He didn't have any contact with his family, and it really struck me because here was someone that was my same age that could have been me, could have been anybody my age, and was really truly suffering, not just from the physical and psychological manifestations of his disease, but also the result of his sickness and all of the what it was affecting. It was affecting his family, not just him, but it was affecting his children, his wife, and all of these other people. And as I worked with him, Temple, I mean, from an academic standpoint, I felt very confident working with the attending I was working with to treat him, to give him the medications to help alleviate a lot of the symptoms of schizophrenia that he was having. But more so, also, and just as important, if not more important, was the fact that, I was able to talk with him and find out these things were really bothering him. To me and you, the hallucinations and things that he was having would be very bothersome, but to him, the most bothersome part was the fact that he lost his family. He wasn't able to talk to his children or his wife or things like that because of everything that was going on. And being able to kind of look at him as a person, not a diagnosis, is something that I think Temple does a really good job of teaching us. Our patients that come in, no matter what they have, whether it's schizophrenia or a heart attack or dementia or diabetes, are more than just their disease. And I think that's really truly what makes Temple such a special place, is that we're trained from a very early age to accept the fact that, these are patients and they come to us looking for help from, some disease process or whatever they're suffering from. But more so, I think as Temple doctors, we're able to not only treat them as someone that has diabetes or schizophrenia, we treat them as someone who has all of these different things going on, who has a family, who has friends, who have a job, all of these things. And we can really, make a difference not only in their disease process, but in their life as well. And really, to me, going into psychiatry, I think a lot of the reason I'm going into psychiatry is that Temple taught me that you need to take a patient in as not just some disease process. Um, it's very important that you see a patient as not a patient but a person, and I think Temple does a great job of doing that. And I can say that going out, it's a scary thought in a couple of months that I won't be at Temple anymore and I'll be a doctor. But at the same time, I feel so confident because I know that Temple has prepared me so well. And going out there, I'm so excited to just kind of show others what great things Temple is doing.